Volkmann's Ischemic contractor. Anatomy. Bones include ulna, radius, humerus, carpal bones, metacarpals, and phalanges. Also included is the median nerve. There are two parts of the forearm. The muscles included in this condition are wrist flexors, as well as wrist extensors can be involved, but not common. Pathology. Volkmann's contracture is caused by a lack of circulation to forearm, by a crash or fracture, which leads to swelling that places pressure on the vessels. There is a deformity of the hand, fingers, and wrist due to injuries to the muscles. With Volkmann's contractures, there is 3 severity levels. The first is mild, which is there is no loss of feeling and contracture to the second and third finger. The second level is moderate. All the fingers and wrist are bent, thumb stuck by the palm, and loss of feeling in the hand. The third and worst level is severe, which is muscles that flex and extend wrist and hand are involved. Compartments of the forearm. Like I said earlier, there's 2 compartments. The first is the anterior compartment, or also the superficial and deep compartment. The muscles involved in the anterior compartment is the flexor carpi ulnaris, palmaris longus, flexor carpi radialis, pronator teres, flexor digitorum profundus, flexor pollicis longus, pronator quadratus, and all the anterior compartment muscles originate from the medial epicondyle of the humerus. The second compartment is called the posterior compartment, and the muscles in this compartment are the brachioradialis, extensor carpi radialis longus and brevis, extensor digitorum communis, extensor digit minimum, supinator, and extensor pollicis brevis. There are 5 P's to Volkmann's contracture. First is pain. Upon palpation on the areas of persistent pain with passive stretching. The second is pallor, which is a bleach view at skin. The third is pulselessness, which means pulse cannot be found. Fourth is paresthesis, which is decreased sensation. And the fifth is paralysis, which is motor deficient. Mechanisms of injury and predisposing factors for Volkmann's contracture. There is not one specific mechanism, but usually caused by internal conditions. Those conditions can be burns, animal bites, bleeding disorders, surgery, excessive exercise, car crash, and fractures. Signs and symptoms. All signs and symptoms affect the forearm, wrist, and hand. Some signs are paleness of the skin, muscle atrophy, decreased sensation, the hands, wrist, and fingers look claw-like, and there is swelling and shiny skin. Special tests. Some special tests that can be done are X-rays, MRIs, and CT scans. And on to the right, you can see is an X-ray of the forearm. Differential diagnosis. One differential diagnosis is SOTU, Volkmann's contracture, which is the mechanical entrapment of the flexor myotendinous units. It commonly involves ring finger, but can also affect the other fingers as well. Another differential diagnosis is a distal radius fracture. Management and treatment. Prevention is the #1 priority. Surgery is the best option, and some types of surgery is the tendon slide, neurolysis, a long extensor transfer, and then after surgery, the patient needs to have stretching techniques, range of motion exercises, and splinting. Referral and mobilization. The patient will be referred to an orthopedic surgeon, and they will be placed into a brace to protect the ligaments. Prevention. Good circulation to the forearm. Splints, bandages, and other objects that obstruct the blood flow should be avoided. And a big thing is early diagnosis. Mulligan. There is no mulligan technique for Volkmann's contracture. Here is my Peacock. And then my references.